Welcome back to another episode of Reading Rehab. This is Data Nerds. I am Mike Brown, joined by
Pat Healy.
and no Brian today. It's just the two of us holding down the fort. But we have a fun case today that I'll be presenting. So this is a case of a pro cyclist with patellofemoral pain. Pat, can you see my cursor as I'm moving it around?
Yeah.
Okay, cool. All right, so going into the case. So she's a 26-year-old female professional cyclist with right chronic patellofemoral pain. This isn't limiting her biking. And she came to us because she likes to run and hike as her leisure activity, but she has not been able to do that in roughly a year. And like with running specifically, she's unable to run more than 3 minutes without some significant sharp pain in her knee. There's a lot of stuff I could talk about with this case, like a lot of other things. Like there's a theme that we've had throughout this is there's some some psychosocial like exercise compulsion sort of things going on. But I'm just gonna stick to the numbers that we had because numbers are easier than people. So
Data, baby.
So also with the case, I think that's relevant. She has a history of a right patellar dislocation 10 years ago, which she didn't get PT for. Just kind of like naturally healed. It dislocated like 2 more times after that, but has been good for like 8 years now. And then for this pain, like she previously worked with a PT that did an emphasis on glute and hip strengthening. Because she's a pro cyclist, she's got some pretty large quads. And the assumption was that her quads were strong because of how hypertrophied they were. But knowing this history of dislocation and that she also has pain on the right side, I don't buy that. So, what we did at eval was some isometric knee extension testing with the Tindeq. Again, because of that history of patellar dislocation, I wouldn't be surprised if she has a strength deficit on that side, which is contributing to symptoms. I wanted to talk about the setup a little bit. I feel like I don't normally talk about that, so I want to be better about that. So she was seated with her knee in 60 degrees of knee extension, or I guess knee flexion. She has a strap around her legs to limit hip flexion, and she was sitting on like one of those boxes that have nothing, like they're just like the metal frames essentially. Um, and she was at a squat rack for that, so she was told to lean back into the rack to support her back, and then hold on to the sides of that box to stabilize herself. So ideally, we're just getting the quad working there. Does that make sense? That
Yes.
description of the setup? Cool. All right. So now the meat and potatoes, the results. So this was at the initial eval. This is different from some of the other cases that I've done, I think, where this one has we did something that I just call a pain threshold. So if we look over to the right of this top one to start, this has the max strength values for her right and her left leg. So her right is the involved side. Um, we can see that's 417 newtons. The left was 601. So already a pretty big difference there, which I'll talk about more. It's at the bottom here. But to me, what's kind of more interesting is we also did, so this was into pain, and I like wrote a note about how much pain and like where it was. But then we also did pain free force that she could develop. So we actually did that one first because in theory, if you did max force with pain first, potentially you could just piss off the knee a little bit, and then and then this metric or this number may be lower, and I guess an argument could be made that, well, now the max force could be lower because you just did 3 other tests before that. Um, and I would actually argue the opposite, that these could be like familiarization tests, that could make this number higher. And because they are at a sub-max level, these likely aren't going to be as fatiguing as the max strength there. That makes sense so far?
Yeah.
Cool. So then what we can see here is that max pain threshold that you could get was 337 newtons. So 417 or 337 divided by 417 gives us a pain threshold of 81. So she can, what this is saying is she can produce 81% of her peak force pain free, but that last 20% is a painful range. Then if we look at the bottom here, overall, now comparing limb symmetry, so that 417 on her right involved side compared to the 601 on her left uninvolved side is a 69% limb symmetry, which is fairly significant there. And then, so that's like, to me, the big key takeaway. Then when we look at when it's normalized to her body weight and length, or her calf length, we can see that her left side is 3.08 Newton meters per kilogram, which is above my like general recommendation of 3.0. 3.0 is being able to kick your body weight. Essentially, that's taken from ACL rehab, where essentially that's, I'll say, like a good enough metric for quad strength there. But then on her right, that's 2.14 Newton meters per kilogram. So again, as we would expect, obviously significantly different from the left side given the symmetry, um, but is fairly low. I guess a nice thing is that what I also look for, again, this is taken from ACL rehab, and I think I've talked about this before too. But I look for greater than 2.0 Newton meters per kilogram just to be able to run. So the max amount that she can generate on her involved side does allow her to run. Um, any questions so far before I go into some more of my like interpretation from this?
When doing it, did you notice anything in regards to time to peak? Like, did
Mm.
it seem like it take her longer to get to that peak on the right rather than the left? Like, was there a problem with RFD? Do you know? Or
Um,
I know it's kind of tough to say because you can't really save that
yeah.
probably. Yeah.
Yeah, you can't really, at least I didn't save the actual like tests, and so I couldn't see what the force profile looked like. I don't even remember if Tindeq gives you that. Um, and we also weren't really queuing for RFD with this one. But yeah, it could be interesting, like even what could time to peak be with no, I guess no queue for it. Like, does it still take significantly longer? I don't know.
Yeah. Yeah. I guess like when you do the test, what is your cue to the patient?
Um, I just took the Dungeons and Dynamometers course, so my queuing would be different. Shout out Dungeons and Dynamometers, great course. Um, but at this point, because this was like 5 months ago, at this point, um, I think my queuing was just like kick out as hard as possible. I don't think at this point I would have told her to like gradually ramp up, which is
Yeah.
now something that I would be doing, because we don't want, I guess, a false peak by like
Yeah.
someone kicking out really quick.
Yeah, like a counter movement or something. Yeah.
Yeah.
For sure.
But she, because of her knee pain, she was generally cautious doing this anyway. So I
For
wasn't
sure.
necessarily worried about that. But
Yeah. Yeah.
that is something that, is, I would consider best practice for doing these.
Gotcha.
Um, but other interpretations, so I talked about this significant strength asymmetry, 81% pain threshold. One thing that I thought was interesting, I actually just did this calculation because I was curious, is the pain free torque to body weight was 1.73 Newton meters per kilogram. So I just talked about that 2.0 Newton meters per kilogram that I look for return for running. She was below that in the pain free range. So it's kind of like yeah, of course she's going to be having pain when she runs, because she's below that number here. There is a significant strength asymmetry. Like all of these numbers actually were really helpful with buy-in, because I was like it's now we can very clearly see that there is this difference side to side, even though you're like both of your quads are large. Like it's good to show that like you can have big quads but still be weak. um
Yeah, I think that comes to the argument, right? It's like hypertrophy doesn't necessarily indicate strength, and strength as a byproduct of neural adaptations as well.
yeah, exactly. So um yeah, that was very interesting testing. But then, so now we can see the previous test here, and then I retested in early February, after roughly 2 months of like blasting the quads with exercise. And as you can see by these red boxes, things got better. So now just going from left to right here. um, Interestingly, pain threshold is roughly the same percent like symmetry. Like now it went from 81% to 85%, but the max pain-free force that she could generate is even above the max force that she could generate on her uninvolved side prior. So the uninvolved max force prior was 601.4. Now max like pain-free force on her involved side is 609. So that's pretty cool. Um and then for right versus left, her involved side 719 newtons, and then her uninvolved side 726 newtons. So if we look at limb symmetry, that gives us if that thing will go away, that gives us a 99% symmetry side to side, which is pretty cool. Um, and then normalized torque to body weight each side 3.68 and 3.72. So both sides got better. Obviously the right side, the involved side, got better by a lot. Um, which is I guess to me one thing that I could take away from this is like, because she had the hypertrophy in the quads, like the capacity to build that strength quickly was there. And then as you mentioned, like it's just that neural adaptation, and probably a bit of the strength training then decreasing pain and fear around this. So then that probably also helped the force output for um yeah. Any thoughts, questions around that stuff right now?
No.
Cool. So other interpretation, still, as I said, still 85% pain threshold, but absolute force much higher now. Absolute pain-free force. And then significant improvement in max strength with 2 months of training. So we can take from this, max strength is no longer the limiting factor. But at this point, she was still having pain. Um, I I'm seeing her this week too, and so I'll just say I'm guessing she still probably has pain now, and it's and it's still even after. Like it's now going to be 4 months after this testing. That's the tough part about patellofemoral pain syndrome. It can last a long time.
Yeah,
Um,
and it's not just directly correlated to strength. Yeah.
yeah. Yeah, so they exactly, not directly correlated with strength. So like why is she still having pain? Couple different thoughts, like there could be um some sort of neural sensitivity still there. There could be either peripheral or central sensitivity. I definitely believe that to be the case. I think she has some, as I mentioned, some other like psychosocial factors going on where there is that exercise compulsion, some catastrophization of her pain. So like that could all be impacting her pain. But I'm here to talk about numbers, not people. So so uh what's the next test I wanted to do? We did the Runeasi, our running gait analysis. And what I take from that is like, so now she can run for longer than 3 minutes, which I consider a necessity for the for the Runeasi. So now my question is there another quality that is impacting her pain? And actually, something that I want to talk about with Runeasi that I forgot to put on here is again the testing setup. So the Runeasi is a belt with an IMU, inertial measurement unit, I think is what that stands for. That goes on the belt. The belt you position at the sacrum, with the IMU between like each PSIS. And then I typically like having people like roll shorts down and then place the belt in the position and then roll shorts back up over it. So actually, usually ladies are wearing some sort of high-waisted like legging, just because like that's what's comfortable for them, and I love that because then it like really just keeps the belt in place. It's a little harder to keep in place. Like I worry more about it if they're wearing like just normal shorts that can kind of like jostle the belt, because I have had issues with that in the past. But um yeah, the high-waisted pants are great with that. Then they hop on the treadmill. I just tell them to go whatever their like normal easy pace is, and generally going more by feel than by the like miles per hour or pace on the treadmill. I don't think our treadmill is perfectly calibrated, so I tell them that, and then say just go by feel there. I start with a 3-minute like familiarization with the treadmill. You can actually, and I've seen this on the Runeasi, because I know in previous ones I've shown the Runeasi PDF reports that show like the metrics over time, and I can see like pretty consistently the first, if I'm measuring from when they first start running on the treadmill to like throughout the whole thing, that the first couple minutes there is like a drastic change in the metrics, and then it gets better after that. So that's why I generally start with a 3-minute warm up, just familiarizing with the treadmill, and then I do 1 minute of data collection. um I say all that, and I didn't do that with her. I just did 5 straight minutes of running. Um, but that's my normal testing process. So now with her, here's the results. Lots of colors. So looking at the left here, so you can see like 5 minutes that we did. Um, I know I've talked about these before, but it's worth going over again. So they have like 3 main variables that they look at. They look at dynamic instability or dynamic stability. That's how much your hips are moving, like a contralateral pelvic drop, or just like translating side to side. Essentially anything that's not helping with like forward motion. Um, they expect there to be some of that. So like a good number that makes like this box green is like 20% or under. And then it goes up as or the colors get closer to red as these numbers go up. Second one is impact loading. So there's impact magnitude and impact duration. Impact magnitude is how much, I say how much force is technically an acceleration, but I don't know. It's easier to think about it force wise, but how much force slash acceleration is going to the belt after you land. So it's just kind of saying like how fast does it like stop essentially from peak height to bottom height. Impact duration then is how long does it take essentially for that force to go from your foot when you strike up to the belt. Um, in theory, you want impact magnitude low and impact duration high. That shows that your muscles are working well actively to, like, I'll say, quote, absorb force. Um, then symmetry, that's what this like bottom right stuff is it shows the symmetry between all these different metrics. I mean, symmetry is an obvious one. You want as symmetrical as possible there. Um, ground contact time, cadence, and flight ratio are all not colored because they are so highly dependent on your speed. But when I look at this 167 cadence, not something I'm too worried about. Flight ratio 34%. That's generally what I see with most people. I generally see like 30 to 35%. So then if they're outside of that range, then I may consider that more important. So looking at these numbers, dynamic instability, not really too much asymmetry side to side. There is a bit of instability side to side, or a bit of instability like in general. Honestly, that's not the main thing that I want to address right now. I care more about these impact metrics. And what we can see is just by colors, that makes it easy. Let's start with left, the uninvolved side. So lower impact magnitude, higher impact duration. That could mean that she's striking with the same amount of force, but then on both sides, but then her muscles are doing a better job absorbing it on her left side than her right side. Again, right side higher than her left by 13.6%. For impact magnitude, and then impact duration, 54 milliseconds and 32 milliseconds. The like dark green that they say I think is around 90 milliseconds. Um, so both are low in general, but then the asymmetry is a dark red. That's not no bueno. 25.6% asymmetry. So that's pretty large. What this tells me, and I think I put it in my interpretation. Yeah, so significant asymmetry and impact metric that can indicate the ability to generate a fast eccentric contraction. What these numbers tell me is that she, despite having the strength now, like we know from back here, she's got the strength, like she's strong, but um she can't generate that force quickly within the dynamic movement of running. So that what I take from that is likely why she is having the pain. Um, and that's why I have this in red here. While her quad strength significantly improves, she still has poor ability to generate power on her involved side. This is likely what is causing her pain while running. I'm sure there's a lot of other things too, but that's to me the biggest. Um, thoughts, questions. Does that make sense?
Yeah, I do have a question.
Mhm.
Um, if you could test, so like, I guess for people who don't know your situation, these two pieces of technology are like the two pieces of tech that you have available to you.
Yeah.
And I bring that up because I feel like I'm kind of seeding a question. Um, if you could test something now that you understand like her, torque production, and you're like, all right, well, I think this is a force application problem, what would you want to test? Uh, yeah, what would you want to
Yeah.
test, and like with what and why?
Um, I mean, there's two things that I think could be valuable to test. One, and I think this is where you were getting, what you're trying to lead me to is some isokinetic testing, and trying like to get rate of force development or rate of torque development there. Because that's to me the like what I've talked about with this impact duration number here, like to me, that's just a proxy for rate of force development. That is the actual, like, obviously, that's how you get rate of force development. And in technically, the Tindeq can do that, but it's just not accurate. It's not a good test. So I do not trust the Tindeq for that. So I'd want to do that isokinetically. If I'll say if I didn't have access to that, because I mean isokinetic dynamometers are not cheap, and not all of us are fortunate enough to have access to them. um, I would then also use like some sort of hop testing as another proxy for it. So I know this is something that when we had Hector Wang on, a while ago now at this point, like we were talking about hop testing, and like single leg drop jump, like that's something I would want to see. That's actually an intervention that I did with her to work on rate of force development. um yeah, does that answer your question? Is that what you were trying to lead me to?
Uh, yeah. Well, yeah, it was. Not initially isokinetically, because my head was more so going towards um things that are going to stress that eccentric portion. So more so utilizing like force plates for
Mm,
things such as like, based on like sensitivity of symptoms, like a snap down analysis, like
yeah,
can she even like produce force under eccentric load that's rapid. And then it's like, okay, if that's a no, then I already know her counter movement jump is going to be shit, because counter movement jump is just going to be a proxy of how good can you deaccelerate on that limb. um and then, yeah, like drop jump would be like the next step for sure, which like that would be huge to see for a runner,
yeah,
um yeah, so that's kind of more so where my head was going at. um but yeah, I still think like isokinetically could be interesting to see, like, is there a certain point throughout the range that she gets her pain? Like, although you hit 60 degrees, is it more painful at, 45 or 30 or something? And it's like, that's kind of hard to tell unless you go fishing for it with an isometric, where you're just like testing each joint angle. Where like that is a benefit isokinetically, where you just have them kick out, pull back 5 times or something as hard as they can, and like you'll see it in the force trace curve. So
yeah, that's a great point, both of those. I will say, run easy, since it's a belt that can then measure
yeah.
accelerations. They were doing some beta testing with some like jump stuff too, so like I could get like reactive strength index and some other, and like a counter movement jump stuff. So it obviously doesn't show the like force profile, but it does, like a force plate would. But it does give numbers similar to these, and again, it gives a reactive strength index. So that's something that I'm excited to play with more in the future, because that could be like, with what we have, that could be my way of testing
Yeah,
the
yeah, that
power.
would definitely, I would be interested to see how the run easy would dichotomize it between limbs. Um, because I could totally see how it would work great for giving you just absolute metrics, such as like, depth, the actual, just like, what does it
Hmm.
look like bilaterally? But I'd be interested to know how obviously if they're able to get all this data independent of each limb, then it surely can't be that hard just to get a jump, like if they're doing whole running stuff. But I'd be interested to know like how that actually works and how well it works, and like comparatively, how does it compared to like force plates. But
Yeah, so that's I can't compare it to force plates, but that's something that I'm excited to play around more with in the future. So, you know,
cool.
run easy. Where I'm looking forward to doing that. One last thing I wanted to say about her case. I feel like it's mostly wrapped up, but so I spelled changes wrong. Oh no. Everything's invalidated. Um, so since like this testing, um, we made some plyometric and power, or we added some of those to the program. So like that single leg drop jump, some other ones like that. I can't even remember off the top of my head. More plyometrics, like run drilly things versus like the classic power exercises like a clean or something like that. But as of this recording, I was just looking at like what her exercise logs look like, and she just ran 2 days in a row for 5 miles and 4 miles. So that's pretty cool. So we can say roughly 6-7 months after starting the program, where she couldn't run for like more than 3 minutes at a time, she can now run 5 miles, 4 miles. That's like 45-ish minutes for her. So
Damn,
pretty
nice.
cool stuff. I don't
Sweet.
know if those were pain free though.
Yeah.
So I got to talk to her later this week to see how those felt. But I wouldn't necessarily expect them to be pain free, but just that like she could do especially the 2 in a row. That can be a lot for the legs. Um, yeah. So I'm excited about that case. Definitely going well.
Yeah, no, that think it's definitely one that is interesting and a good highlight of the fact that it's not just strength,
Yeah.
like
Yeah.
like improving absolute torque is not gonna solve everything. And sounds like you found the needle in the haystack, hopefully.
Yeah. Hopefully, right? Doing something right. But yeah, I think that's a good place to wrap up. So as always, if people have listened or watched this far, this does go on YouTube. It is best watched, so then you can see all the stuff that I'm pointing out. But if you've listened or watched this far, please leave a like or subscribe on YouTube, or a nice review on Spotify, Apple Podcasts. We always appreciate it. Thanks.